Yorkshire are warning that the NHS isn't up to coping with a growing problem of tooth decay because of a lack of long-term investment in the service.
They say the problem is made worse because half of adults and 1 in 3 children in the country hasn't visited the dentist in the past year.
That's been blamed on a lack of education, and they say it could be storing up major health problems for the future. Katie Oscroft reports.
Good. Well, as usual, we're going to give your mouth a general oral health check.
A routine trip to the dentist, and at this West Yorkshire practice there's always good advice about how to keep your teeth clean and free of decay. But it's the people who don't come through the door who are the biggest problem.
It's always difficult to get a place at an NHS dentist. All dentists are relatively busy, especially in Yorkshire, because the dental disease rates are increasing. And yet when you go to the dentist, you'll find that they're telling you how to prevent the problems too. And it's such a great shame that you have to actually get into the dentist before you're finding out how you could have prevented the problems or certainly dramatically reduced them in the first place.
So now I'm just going to check the soft tissues of the mouth. So if you open it really big and wide.
Figures which have just been released paint a disturbing picture of the number of people not having checkups in the 12 months until this June. 22 million, that's half of all adults, didn't visit an NHS dentist. Almost 5 million children didn't either, that's 1 in 3. Yet £740 million was made by the NHS in takings from charges to dental patients.
It's nothing short of a national disgrace. And the government really have got to start addressing the problems that we're seeing. They have no coherent oral health strategy. There's a distinct lack of investment, and really patient education is something that they have just not been addressing in the slightest.
I haven't been in ages.
I haven't been in over 12 months.
I obviously don't want your teeth to fall out, but it's just so expensive.
I reached the point where I then had to pay for it, and then I went to university and I was in different places, and you know, just going to a new dentist place and moving away from where I lived and then having to pay, I just never got round to it.
Well, I see my dentist quite regularly. My mum's always sort of made sure that she goes in and sorts me out.
A bit of preventative is definitely cheaper than having a lot of work.
In much of Yorkshire, the figures are slightly better than the national trend, but dentists warn that the pressure on NHS clinics is increasing and investment is needed. Katie Oscroft, ITV News.